This session describes the parasympathetic nervous system. The learning objectives are to describe the parasympathetic supply to the different parts of the body, explain the effects of parasympathetic nervous system on the body, and to describe the clinical application of this session. The parasympathetic division is the craniosacral outflow of the autonomic nervous system. The cranial outflow supplies the visceral structure in the head and neck via the oculomotor, the facial, and the glossopharyngeal nerves. About 75% of all the parasympathetic nerve fibers are in the vagus nerve, passing to the entire thoracic and abdominal viscera. The sacral outflow supplies the pelvic viscera via the pelvic branches of the second, third, and fourth sacral spinal nerves. Remember that the parasympathetic division of the autonomic nervous system is dominant during rest. Remember that the preganglionic fibers in the parasympathetic outflow relay in collateral ganglia or end on short postganglionic neurons located on or near the visceral structure in the form of terminal ganglia. The ciliary ganglion for the third cranial nerve to the eye, the sphenopalatine and submaxillary ganglia for the seventh cranial nerve, and the otic ganglia for the ninth cranial nerve are considered as collateral parasympathetic ganglia. Now, the terminal ganglia are present very near or in the visceral organ itself. They are for the relay of the 10th cranial nerve, the vagus, its parasympathetic fibers, and also for the pelvic parasympathetic fibers. The postganglionic fibers are very short, about 1 millimeter, up to several centimeters in length. The parasympathetic supply to the head and neck is provided via the oculomotor nerve, facial nerve, and the glossopharyngeal nerve. Starting with the oculomotor nerve, which is the third cranial nerve. The preganglionic parasympathetic fibers arises in the Edinger-Westphal nucleus in the midbrain. They relay in ciliary ganglion. The postganglionic fibers enter the eye as the short ciliary nerves. The postganglionic fibers of the oculomotor nerve enter the eye as the short ciliary nerves, producing contraction of the constrictor pupillae muscle, leading to constriction of the pupil, which is known as miosis. In addition to miosis, the short ciliary nerve increases the dioptric power of the lens of the eye to near vision to ensure that the visual image is focused on the photoreceptor. This is known as accommodation. To understand accommodation, you have to know that in far vision, the ciliary muscles are relaxed and the suspensory ligaments are stretched. Thus, the lens is flattened. While in the accommodation to near vision, there is contraction of the ciliary muscles, relaxation of the suspensory ligament, the zonules. Thus, there is increase in the curvature of the lens, which will increase its dioptric power. So remember that the postganglionic fibers of the oculomotor nerve enter the eye as short ciliary nerves. It produces miosis and accommodation, both of which are component of the near response. The next cranial nerve that has parasympathetic supply to the head and neck is the facial nerve, the seventh cranial nerve. The preganglionic parasympathetic fibers arises from the superior salivary nucleus in the lower pons. Some fibers will relay in the sphenopalatine ganglion. The postganglionic fibers will supply the lacrimal and the nasal glands. Other fibers will run in the chorda tympani branch of the facial nerve to relay in the submandibular ganglion. The postganglionic fibers will supply the submandibular and the sublingual salivary glands. The parasympathetic fibers to all these glands are secretomotor and vasodilator. Thus, it produces vasodilatation of the blood vessel and increase the secretion of the lacrimal and nasal gland, the submandibular and sublingual salivary glands. The next cranial nerve that has parasympathetic supply to the head and neck is the glossopharyngeal nerve, the ninth cranial nerve. The preganglionic parasympathetic fibers arises from the inferior salivary nucleus at the junction of the pons and medulla. They relay in the otic ganglion. The postganglionic fibers supply the parotid gland. The parasympathetic fibers to the parotid glands are secretomotor and vasodilator, thus produces vasodilatation of the blood vessel and increase the salivary secretion of the parotid gland. So remember that the parasympathetic supply to the head and neck is provided via the oculomotor nerve, the facial nerve, and the glossopharyngeal nerve. Now coming to the parasympathetic supply to the thoracic and the abdominal viscera. The thoracic and abdominal viscera are supplied by the vagus nerve, the 10th cranial nerve. The parasympathetic supply to the thoracic and the abdominal viscera is provided via the vagus nerve, the 10th cranial nerves, in which the preganglionic fibers arises from the vagal nucleus in the medulla. They relay in terminal ganglia present in the wall of the effector organs to supply the heart, the lungs, the gastrointestinal tract, and the gallbladder. The effect of vagal stimulation on the heart include inhibition of all cardiac properties of the atrial muscle only, as the vagus does not supply the ventricle. Inhibition of all cardiac properties means decrease in the excitability, rhythmicity, conductivity, and contractility. This is accompanied by decrease in the coronary blood flow and the oxygen consumption. The effect of vagal stimulation on the lung include constriction of the bronchi and bronchioles, that's to say bronchoconstriction, stimulation of the bronchial glands, thus increasing its secretion, and vasodilatation of the bronchial blood vessels. Vagal stimulation to the abdominal viscera sends motor fibers to the plain muscles of the esophagus, stomach, small intestine, and the proximal part of the large intestine. This leads to contraction of the wall of the GIT. It sends inhibitory fibers to the sphincter, and this produces relaxation of the sphincters. It sends secretory fibers to the GIT glands, liver, and the pancreas. This leads to increase the secretion of the GIT gland, liver, and the exocrine secretion of the pancreas. It also sends motor fibers to the wall of the gallbladder and inhibitory fibers to the sphincter of Oddi, leading to evacuation of the gallbladder. So remember that parasympathetic stimulation leads to bile secretion from the gallbladder as a result of contraction of the wall of the gallbladder, relaxation of the sphincter of Oddi, leading to evacuation of the gallbladder. Now the parasympathetic nervous system supply to the pelvic viscera. The preganglionic fibers arise from the second, third, and fourth sacral segment. They run as the pelvic visceral nerve to relay in terminal ganglia in the large intestine, rectum, urinary bladder, male and female genital organs. At the level of the distal part of the large intestine and the rectum, the parasympathetic stimulation produces contraction of the wall of the rectum and relaxation of the internal anal sphincter, leading to defecation. At the level of the urinary bladder, the parasympathetic stimulation leads to contraction of the wall of the urinary bladder and relaxation of the internal urethral sphincter, leading to micturition. At the level of the male genital organs, the parasympathetic stimulation produces vasodilatation of the blood vessels of the penis, thus leading to erection of the penis. At the level of the female genital organs, parasympathetic stimulation produces vasodilatation of the blood vessels of the clitoris. What could be the clinical application of today's session? The pupillary light reflex is a clinical application of this session. The doctor's hand is put in between the patient's eyes and a torch is used to shine the light from the side. When the light is directed to one eye, it strikes the retina and through a series of CNS connections activates parasympathetic preganglionic nerves in Edinger-Westphal nucleus. Activation of these parasympathetic fibers causes contraction of the constrictor pupillae muscle, and the pupil of this eye constrict to decrease the amount of light falling on the retina. This is known as direct pupillary light reflex. The pupil of the unstimulated eye also constrict, and this is known as indirect or consensual reflex. Remember that when light is directed to one eye, the pupil of this eye constrict. This is known as direct pupillary light reflex. And the pupil of the unstimulated eye also constrict, and this is known as indirect or consensual reflex. The accommodation reflex is a clinical application of this session. The doctor asked the patient to look at that point on the wall and then to the doctor's finger. The sudden shift from the far vision to the near vision produces a blurred retinal image that activates parasympathetic preganglionic neurons in Edinger-Westphal nuclei and leads to contraction of constrictor pupillae muscle, thus producing constriction of the pupil. At the same time, the ciliary muscle contracts, causing the lens to round up and increase in its curvature, which will lead to increase in its refractive or dioptric power. By this, we finish today's session. I hope you enjoyed it. Thank you.